Tonight, we are joined by people on the front lines of Oregon's drug crisis. We're asking, is Measure 110 the answer?
We need a healthcare response to the addiction crisis. The criminal justice system has failed for 50 years to actually solve this crisis. We know that more services, more people out on the streets being able to connect folks to services works, and we need to really invest in the services that are so critical.
Prior to COVID, Oregon was ranked dead last to access to care. When COVID hit, it decimated our system, just like every other sector in this country. The criminal justice approach for possession only, I am not talking about other crimes, is not the right approach. We need rapid access to care, and we need to continue to invest. A repeal would be like throwing gas on the fire right now.
What I want to remind everybody is nobody wakes up and says, I want to be a drug addict. People are dying. They need help. It's affecting all races, all cultures, all money levels. It's affecting all of us. When you're looking at, arresting people for small levels of possession, how will that affect the opioid user? Because if you lock them up and then you release them and they try to use what they just used 10 days ago, the level of them overdosing is almost automatic. When Measure 110 was voted in, we knew it was the right thing to do, and let's not lose heart because there's some kinks we need to work out.
The 25 states in the United States that have a higher overdose death rate than Oregon all criminalize people for drug possession. How well is that working for them? My recovery, my success is despite my incarceration, not because of it. When my best friend relapsed on fentanyl a few months ago, she was able to get a same-day visit with a provider on her cell phone and start Suboxone that night. That was a Measure 110 funded service. Thanks to Measure 110, I see hope.
I believe that people voted for Measure 110 to see how they could help. They were hopeful that something could happen different than what was happening before. With Measure 110, we have outpatient treatment, and we primarily work with Black, Indigenous, people of color, and military veterans. And we have highly supportive, accountable, sober living and treatment. People are lining up every day just to be able to get into treatment.
Measure 110 has afforded us the opportunity to create these resources, and it also helped change some of the impact of the war on drugs against what happened to Black folk. This is not a real simple problem. And so if we think just because we passed the law and done these things, it's going to change, we have to put the resources in place. We have to train the people. Measure 110 is a good thing, and I think the Oregon voters knew what they were doing.